Today, we're going to tackle one of the most important and potentially life-saving topics in senior healthcare. Many tests routinely ordered for adults over 70 are not automatically helpful, and you have the right to press for clarity before consenting. It's time to surface evidence that too often remains buried or is communicated poorly to older patients, so you can tell which evaluations genuinely improve outcomes, and which ones stir up needless worry, lead to false labels, and open the door to risky overtreatment. When you can separate high-value testing from low-value testing, you do more than safeguard your health. You make informed choices that can preserve quality of life and even extend longevity. Consider this a space where patient advocacy takes precedence over rigid checklists, where thoughtful consent replaces automatic compliance. Whether you are over 70 yourself or supporting an aging parent or partner, the guidance ahead can help you avoid procedures and follow-ups that offer little benefit and may cause harm. Let's move forward with clear eyes, practical evidence, and the confidence to ask careful questions before agreeing to any test. Here is the difficult reality I have witnessed across 25 years in geriatric urology. 5 tests that are commonly ordered for people over 70 frequently trigger overdiagnosis, overtreatment, and serious complications, yet 91% of physicians do not candidly weigh the risks and benefits with their older patients. So, let's address the specific evaluations that raise my deepest concerns. After 2.5 decades of seeing them harm more elders than they help, I am repeatedly asked a familiar question. Doctor, I am 73, and my clinician wants to run several tests, including a PSA for prostate cancer and a colonoscopy, among others. I keep hearing that some screenings at my age are unnecessary and could even be harmful. Which ones deserve pushback, and what does the evidence actually say about testing after 70? Versions of this question arrive from seniors bewildered by aggressive workups, from families watching loved ones shepherded into procedures they may not need, and from a growing recognition that more medicine is not automatically better. Especially past 70, the priority is to understand when testing truly helps, and when it invites needless anxiety, false labels, and risky interventions that can diminish health rather than protect it. Stay with me for this entire discussion, because by the end, you'll have the tools to shield yourself or someone you love from unnecessary medical harm while still preserving appropriate care. Here is the clinical reality that is rarely stated. Plainly, testing after age 70 demands a fundamentally different risk-benefit calculus than testing in middle age. What might be life-saving at 50 can inflict real harm at 75. Yet protocols are too often copied over without regard for age or life expectancy. As in all geriatric care, decisions must be tailored to the individual, grounded in overall health, likely years ahead, and personal priorities for quality of life. Uniform screening playbooks overlook the hard truth that aggressive intervention in older adults often worsens outcomes rather than improving them. With that foundation, let's turn to the essentials. Which 5 tests are commonly overordered for people over 70? Why can they become hazardous at this stage of life? What does the research actually show when weighing risks against benefits? And most importantly, which questions should you bring to your clinician before consenting? We will begin with the testing realities that too many patients never hear explained up front. 1. Routine cancer screening with CT scans and extensive imaging. Ordering CT scans. PET scans and other broad imaging just to look for cancer is common in older patients, but these tests deliver substantial radiation and routinely uncover incidental findings that spark invasive follow-ups. Many of those abnormalities are clinically trivial and would never affect health within the remaining lifespan, yet once discovered, they cascade into biopsies, surgeries, and treatments that inflict real harm without improving survival. Research reported in JAMA Internal Medicine found that incidental imaging findings in elderly patients led to complications from downstream procedures in 23% of cases with no survival advantage. Before proceeding, ask what specific symptom or clinical concern makes this scan necessary. How likely is any result to change my treatment or extend my life? And what is the risk of uncovering findings that trigger harmful interventions? 2. Aggressive diabetes, screening, and tight glucose control targets. Diabetes care matters, but pushing for very low glucose targets, HbA1c under 7.0 in frail older adults, often creates more danger than benefit by provoking severe hypoglycemia. Evidence across multiple studies shows that intensive glucose lowering in the elderly is linked to higher mortality rather than lower. In this group, the risk confusion, faintness falls, emergency visits and hospitalizations outweigh any hypothetical long-term gains when life expectancy is limited. Reflecting this reality, the American Diabetes Association recommends easing targets for seniors with reduced life expectancy. An HbA1c range of 7.5 to 8.5 is appropriate for many. Despite this, clinicians frequently aim for tighter control, inadvertently inviting harmful complications. Questions to bring to your visit include, given my age and overall health, which glucose goals fit my situation? What is my risk of hypoglycemia if we pursue strict control? And would a more relaxed target provide a safer balance? 3. Routine mammography screening after age 75. As with prostate screening, breast cancer screening in very elderly women often results in overdiagnosis and subsequent overtreatment of cancers unlikely to matter within the remaining lifespan. Research in JAMA Internal Medicine found that mammography in women older than 75 detected many cancers, yet treatment did not improve survival. Instead, it triggered surgeries, radiation, and chemotherapy that reduced quality of life without extending it. The harms involve not only the anxiety from false positives, but also the tangible damage of treating slow-growing tumors that pose little threat. In this population, breast cancer therapies carry substantial complication risks and can, in some cases, shorten rather than lengthen life. Questions to bring to your clinician include these: considering my overall health, what is my realistic life expectancy? If a slow-growing cancer is discovered, would treatment truly extend my life or primarily diminish its quality? And what does the evidence show for women my age? FAR, routine colonoscopy after age 75. Colonoscopy is highly valuable for detecting colon cancer in younger adults, but past 75, especially after a series of normal screenings, the balance often shifts toward harm. In older patients, colonoscopy carries markedly higher chances of perforation, significant bleeding, and anesthesia-related complications. For people over 75, overall complication rates are roughly 3 to 4 times those seen in younger groups. If polyps are discovered, the subsequent interventions introduce additional risk on top of the procedure itself. The American College of Physicians advises against screening colonoscopy in average-risk adults older than 75 who have had prior negative examinations. At this age, the odds of developing a treatable colon cancer that will meaningfully shorten lifespan are very low, while the hazards of the procedure are substantially higher. The key questions to bring to your clinician include these: given my history of normal colonoscopies, what is my real risk of developing a life-shortening colon cancer? What are the specific complication probabilities at my age? Are there less invasive options such as stool-based tests? 5. PSA screening for prostate cancer after age 75. Among older men, this is the most frequently ordered test that ends up causing substantial harm. The U.S. Preventive Services Task Force advises against PSA screening once men are past 70, because the downsides exceed any potential upside. The core issue is that prostate cancers in this age group usually grow so slowly that a man is far more likely to die with the disease than from it. Yet a positive PSA often cascades into biopsies, bringing risks of infection, bleeding, and pain, followed by aggressive treatments such as surgery or radiation that can leave permanent incontinence and erectile dysfunction, all to address cancers unlikely to matter within a typical remaining lifespan. A major trial published in JAMA, tracking 76,000 men, found no reduction in deaths for those screened after 70, but did document considerable harm from overdiagnosis and overtreatment. In short, you assume serious risks without a survival payoff. The questions to raise with your clinician are, these given my age and overall health, what is my realistic life expectancy? Am I statistically more likely to die with prostate cancer than from it? And what are the concrete risks of the biopsy and proposed treatments? Here is a concrete case that shows how these tests can inflict harm. A 78-year-old man was sent to me after his primary clinician ordered a routine PSA test despite his age. The result was mildly elevated, which led to a biopsy that triggered a severe infection requiring hospitalization. Pathology revealed a slow-growing prostate cancer, and his urologist advised immediate surgery. When I assessed him, I estimated his life expectancy at roughly 8 to 10 years based on his overall health. The cancer's natural course was likely 15 to 20 years before it would cause trouble. Surgery would almost certainly leave him incontinent and with erectile dysfunction for the rest of his life. If he declined intervention, he was far more likely to die of another cause long before the cancer became relevant. He chose active surveillance, meaning no treatment other than careful monitoring. 5 years later, he is 83, living fully, and the cancer has not progressed. Had he accepted the original aggressive plan, he would have spent his final years coping with incontinence without any gain in survival. This scenario is not an outlier. I have cared for hundreds of older patients harmed by tests and treatments that should never have been initiated in the first place. The medical evidence on testing after 70 is straightforward. Evidence point. Number 1. Most professional societies now advise against routine cancer screening in adults older than 75 who have limited life expectancy because the harms consistently exceed any benefits. Evidence point number 2. Decisions should be individualized according to overall health and realistic life expectancy, not by the calendar alone. A robust 75-year-old is not the same as a frail 75-year-old. Evidence point number 3. The key question is not, can we detect a disease, but will detecting and treating this condition improve either longevity or quality of life? For many diagnoses in older patients, the answer is no. Evidence point number 4. Patients are entitled to refuse any test. A physician's order does not obligate you to comply, especially when data show the test is more likely to harm than help. Before consenting to any test after age 70, ask 3 questions. Question number 1. What is my realistic life expectancy given my overall health? If it is under 10 years, most cancer screenings are generally inappropriate. Question number 2. If this test identifies something, what treatment would follow, and what risks would that treatment carry? When treatment risks are high, the test may not be worthwhile. Question number 3. What does the evidence show for people my age with my health status? Insist on data, not default protocols. You have every right to make informed choices anchored in your priorities rather than following routines built for younger and healthier populations. Before we finish here is an essential note for older adults who are taking charge of their health decisions, yet want to sustain overall vitality while sidestepping unnecessary interventions. Making informed choices about testing matters, and it can be paired with natural supports that help maintain energy and wellness without the risks that come with aggressive medical care. For that reason, I point to 2 options that help seniors preserve health while avoiding needless medical exposure. For those seeking gentle everyday support while they scrutinize unneeded tests, consider organic watermelon extract, rich in natural L-citrulline. It supports circulation, cardiovascular function, and steady energy without the burdens of invasive approaches. If your goal is comprehensive optimization, not only steering clear of harmful testing, but also maintaining stamina, cognitive clarity, and vitality that keeps you well enough to avoid medical interventions in the first place. Consider the Advanced Senior Vitality Formula. This blend combines Icarian from horny goat for circulation and energy, Tonkat Ali for natural hormone and vitality support, fenugreek for sustained energy and healthy aging, nettle root for prostate health without aggressive treatment, and concentrated L-citrulline for optimal cardiovascular support. Together, these ingredients foster health and vitality, in ways that help you maintain wellness, naturally reducing reliance on intensive testing and procedures. You will find links to both options in the pinned comment and the video description. Take charge of your care with solid information and natural support. After 70 Wise Healthcare isn't about doing more tests. It's about asking better questions, weighing benefits against risks, and choosing what truly serves your expected lifespan, overall condition, and quality of life. You always have the right to decline any test when the evidence shows it is more likely to harm than help. Keep the 3 essentials front of mind before you consent. What is my realistic life expectancy given my health? If something is found, what treatments would follow and what risks would they carry? What does high-quality evidence show for people my age and status? Pair smart decisions with gentle natural support, like the options noted above to sustain circulation, energy, cognition, and prostate health, helping you stay well without unnecessary interventions. If today's message helped you or someone you love, subscribe to the channel, turn on notifications, hit like, and share this video with your family. Your proactive choices today can protect many healthy years ahead.